working past age 65 and want to avoid the penalties and mistakes in enrolling or not enrolling in Medicare? Well, you've come to the right place. We're going to tell you exactly what you need to know in this situation. Hi, this is Kathy Bukowski, and this is the CB Health Insurance YouTube channel. Welcome. Today's video, we're going to cover all of that. Should you or should you not enroll in Medicare, and how do you avoid the mistakes? First, if you're new to our channel and watching for the first time, please be sure to subscribe, hit the little bell so you get future notifications when we release new videos, which is about twice a month. Tell your family and friends, give us a thumbs up, and don't forget to leave a comment. I do check them and try to get back to people as often as possible. Now, on to today's videos. Our office gets questions all the time. I'm still working. I have group coverage. I'm turning 65. What do I do? Do I sign up for Medicare? Do I delay? How do I avoid the penalties? Do I sign up for which parts of Medicare do I sign up? If I sign up, can I still keep my group coverage? Please help me. These are all the questions that we get in our office. So first of all, let's talk about who must sign up for Medicare. There are people who are working past age 65 and maybe they don't get a group health insurance plan through their employer. Maybe they're uninsured. They decided not to buy a policy, and hopefully that is not the case, but those people will want to sign up right away if you are uninsured, first and foremost. Second of all, if you have an individual policy, individual policies are not designed to go past age 65. It could be an ACA, Affordable Care Act plan, either on or off the marketplace that either you or your employer pays for. It could be a Christian sharing plan or other sharing plan. It could be a short-term medical and indemnity policy. Any of these individual policies will typically end at age 65, or you don't want to continue. You'll want to sign up for Medicare when you turn 65 to avoid the late penalty. Other individuals who will want to sign up is if, let's say you're on COBRA, you got downsized, but you still want to work. You're looking for a job, you're paying the COBRA premiums, you're interviewing, and oh, by the way, you turned 65. Go sign up for Medicare right away, because COBRA is not creditable coverage for Medicare Part B, and if you delay enrolling, you could face a penalty later. So don't do that. If you're a retiree, now, I know we're talking about people working past age 65, but there's a lot of people that have government jobs, work for state universities. They might get a pension after 25 years. They might retire in their mid-50s or 60, and they're on a retiree plan. And so when they turn 65, they might still have a job. You know, they might go get either part-time work or do some sort of consulting. They're still working. However, they're on this retiree plan. The second they turn 65, Medicare becomes primary. They're going to want to sign up. And last but not least, those individuals that are on TRICARE for life. TRICARE is the government's health care for our veterans. It's people that have served in the military, and what they call TRICARE for life is your primary, but you have to go to the VA office to get benefits. You will absolutely want to sign up, because at age 65, outside of that VA hospital, you'll want to have Medicare A and B. If you delay, you could pay a late penalty, and you don't want to do that. Now let's talk about everybody else. Let's say you're working past 65 and you work for an employer, and the employer offers you group health insurance coverage and you are enrolled in the plan. Do you sign up for Medicare? Do you not sign up for Medicare? Well, the answer is it depends. How's that for an answer? Some people have to, and some people can delay. So let's talk about, first and foremost, who has to sign up. The law is very clear. The federal government has defined MSP, Medicare Secondary Payer Rules. It says when you become eligible for Medicare, which coverage is primary? Is it your employer group plan, or is it Medicare? And it's defined by the size of the company. So if you work for a company that has less than 20 total employees, that's full-time, part-time, and seasonal, and everything in between, you must enroll in Medicare. If you don't, you will pay a late penalty later, and you might have problems with claims, okay? Now, can you keep your employer plan? Absolutely. However, it might not be a good plan for you. You're still going to pay a really high premium, and oh, by the way, the employer might still be willing to split the premiums or pay for your supplement and your drug card and even Medicare premiums, and they're allowed to do that. that. So talk to your employer and talk to a broker. If you work for a company that has less than 20 employees, you're going to keep on working past age 65. Absolutely go sign up for Medicare Part A and B. Now, everybody else who's over 65 working for a large company, 20 employees or more total, part-time, full-time, all other employees, you can delay enrolling. You will not face a late penalty. You have the choice to enroll or not enroll. Now let's talk about which parts do you enroll in and which parts do you delay and what you should do. Here's my advice. Scenario number one, don't enroll in Medicare A and B. If you are still working for a large company and it's over 20 employees and you have their group health insurance plan, first of all, Part B has a premium to it, right? And Part B, Medicare is going to be secondary. Your group plan is going to pay first and foremost. So the group plan pays first, Medicare second. By the way, they're never going to get around to paying. And you're paying for this premium for coverage that you probably won't ever use. So if you turn 65 and continue to work to age 70, you've paid 5 years of premiums that you didn't need to have to pay. Now, the other reason for doing that is when you enroll in Medicare Part B for the first time, there's a federal law, you have a guaranteed issue to window, a 6-month window to buy a Medicare supplement, no questions asked. At age 65, you might be healthy, but if you retire at age 70, maybe something came along, you have a health condition and you're not eligible. If you enrolled in Medicare Part B at age 65, you will not have a guaranteed issue period to buy a Medicare supplement, no questions asked, at age 70. So don't enroll in Medicare A and B if you're still working past age 65 and you're on a large employer plan. You could, scenario number two, sign up for Medicare A only. Remember I said don't sign up for A and B. What about A only? Well, you could absolutely do that. Why would you want to do that? Well, first and foremost, Medicare Part A doesn't have a premium, right? Currently, it's a zero premium. It's not free. We've been paying Medicare taxes all along, but there is a zero premium right now. We don't know if there will be one in the future, but right now it costs you nothing. And so by getting signed up, you get your little Medicare card in the mail, right? You're official, you're in the system, and it sometimes makes it easier to enroll in Medicare later because you already have your Medicare card. They have you in the system. So it's real easy to get Part B. So oftentimes people will enroll in Medicare A only. It's really your choice whether you want to. There is only one scenario where I will tell you, do not enroll in A. And that would be if you are enrolled in a group health plan that is deemed an HSA qualified plan. What is HSA? It stands for Health Savings Account. It's a high deductible health plan. It allows you to have an HSA health savings account at a bank and makes tax deductible contributions. If you're enrolled in any parts of Medicare Part A or B, you cannot make the contribution, nor can your employer. You will face taxes and penalties. Now, there are some exceptions. If it's your spouse's coverage, I actually did a video on HSAs and Medicare that goes into more detail. But generally speaking, if you are on an HSA, most people will wait to enroll in Medicare Part A later. There are some gotchas that you need to know about signing up later and a look back rule, so go watch that video if that's your situation. But if you are not in a high deductible health plan and working past age 65, there's no reason why you can't just sign up for Medicare Part A. Now, later you will have, when you retire or when you leave that employment, and you will have a SEP. What is the SEP? To enroll in Medicare Part B. A SEP is a special enrollment period, right? You're losing your group coverage. Now, it could be because you're retiring. If you decide to retire, and let's say you're planning this, right? So you just turned age 70 and you're maybe a teacher and you're going to retire over the summer and enjoy your summer months. So you're going to retire June 1st. That's when your coverage ends. You will want to get to enroll in Medicare Part B probably at least 2 months prior, start that application process. And I would say 2 to 3 months. because not only do you need the application for Part B, but you also need your employer verification form. It is a form that you can find on the Medicare.gov or Social Security website that shows you have to take this to your employer or your HR manager, and they have to complete it saying you have had credible coverage this whole time, so you don't pay a late penalty for Part B. Okay, now if you've had 2 jobs since turning 65, you're on your spouse's plan, let's say, and then he retired because he's older than you, and then you jumped on your plan, you will need to get a form from both employers to prove that you've had creditable coverage for Medicare Part B this whole time since you turned 65, so you don't pay a late penalty. That's the key here, right? We don't want to pay extra because, oh, by the way, the late penalty is 10% for every 12 months delayed for the rest of your life. It's tacked on to Medicare Part B. So don't want to do that. You want to avoid that at all costs. Now, who else would have a SEP? One, we talked about retirement, but let's say you're downsized. Let's say the company lets you go. And now they have to offer you COBRA, which is continuation of coverage. That is the federal law. But the second you walk out the door and are offered COBRA, your group health plan is not primary. COBRA is not primary. You need to go sign up for Medicare Part B ASAP, right away, whether you take the COBRA, whether you're still looking for a job with benefits, okay? And the reason is, now the law does say that you have 8 months to enroll in Medicare Part B. However, there is kind of a gotcha. COBRA is not creditable coverage, and you could face a late penalty if you wait the 8 months. So don't do that. We've been working really hard. I say we've, people that are in agents that are part of the NABIB association that I belong to have been trying to get this law changed, because a lot of people are under the impression they have 8 months to do it, and you really don't, because COBRA is not creditable coverage. So you want to go sign up right away. So hopefully that has answered the question. I'm turning 65. What do I do? How do I avoid these penalties and mistakes? Do I enroll in Medicare? Do I not enroll in Medicare? Please help me out. Hopefully you have more clarity on that. We appreciate you watching. Until next time, this is Kathy Bukowski, the owner of CB Health Insurance.